Thanks, Dr. Shepard. The questions continue to come in. Another question, what type of programs work in underinsured and uninsured? How do you get them to change?
Well, my personal opinion is that we don't necessarily need to get them to change. We need to change our systems to fit what their needs are. And so we didn't have a problem engaging those people. We had centering for some of those folks, and they were very active participants in centering. Most of the time when they weren't participating in programs, it was because the program didn't meet their needs or wasn't presented to them correctly. We have a home visiting program where we have about 85% low-income people, although it's not income limited. But we find that overall, those who participate do very well.
Thank you, Dr. Shepard. Another question, budget was considered a factor in the lessons learned. With the same budget and in retrospect, which lessons would you still consider valuable?
Well, I think all the lessons are still valuable, and I think it was a good idea to do this without investing huge amounts of money in each of these sites, because that's just not going to be feasible these days. The idea was to take what they already had going on and make it better. And I think that was still worthwhile, and I still think that that's why, as we continue to monitor these sites, they are continuing to show decreases in their preterm birth rates. And I think what we've encouraged them and set them up to do is to take what they have and improve it based on current best practices.
Very good. Another question, what performance measures did you use in the evaluation process?
We used a lot of performance measures. We looked at referral numbers, for instance, referrals to the quit line, referrals to smoking cessation, referrals to our home visiting program, so just those kinds of service numbers. We looked at preterm birth and late preterm birth. We had planned to, but ended up not looking at the hospital costs for the babies who were preterm from the project. We did a lot of surveys of knowledge, attitude, and beliefs. And again, those were very labor-intensive, and the information we got out of them was not particularly useful. So we tried to use existing data whenever possible.
Thank you, Dr. Shepard. And now a question for Dr. Coe, the Assistant Secretary for Health. Dr. Coe, what is the Healthy People 2020 initiative doing to address this particular health concern?
Well, we've set targets for the prime indicators for infant deaths and preterm births, as we've summarized here. And then we're also trying to make this data available at the state and even local level, if possible, to drive action in those specific areas. So the more we share these data nationally and statewide, the more we share best practices, as we've just heard from the state of Kentucky. And this is a very impressive presentation, and thank you very much, Dr. Shepard, for your insights. And the more we encourage one another, we can keep these goals in mind and try to align all of our efforts for healthier futures for the next decade and beyond.
Thank you, Dr. Coe. I think we have time for just one additional question, and I will take this question. Several of the attendees have asked about the slides and their access to the slides. All attendees will receive a PDF copy of the webinar, and the webinar will also be archived on healthypeople.gov. Well, let me thank you for joining today's webinar. This webinar is part of a series, and we will hope you'll continue to join us each month. Follow us on Twitter or join the Healthy People 2020 group on LinkedIn to continue the conversation on this LHI topic, maternal, infant, and child health, and to learn more about all the leading health indicators. To receive notices about upcoming events, please sign up for our email announcements on the Healthy People website. That's healthypeople.gov. Also, let me say we'll be hosting the 2012 National Health Promotion Summit entitled Prevention, Promotion, Progress. It'll occur on April 10th and 11th in Washington, D.C., and you can find additional information on our website. On behalf of HHS, I'd like to say thank you to today's presenters and to everyone who's been involved with planning and implementing Healthy People 2020.